I'm Christina Fanning. Well, Dr. Christina Fanning now. I graduated with my DAT from AT Still, and I've been at Michigan for 8 years. I actually started here with cross-country track and field, but now I'm women's basketball and women's golf as my primary sports that I serve. We're generalists, so we have to know a little bit about a lot of different things. So whether it's general medical conditions like skin conditions or illnesses, or chronic diseases, but then we also have to know, emergent care. We need to know acute care for different injuries and chronic conditions or post-op conditions. So you have to be able to assess those problems, make a legitimate diagnosis on, is this going to an ortho or a primary care and things like that. And then, we're part of the care team. So sometimes it doesn't need to go to a doctor, and there we have standing orders that we can just take care of those conditions, like an ankle sprain. And then there's other conditions that will work as a team with an interdisciplinary group. So that might be a PCP, an ortho, athletic counseling, dietitians, maybe taking care of a patient dealing with relative energy deficiency syndrome. So that's a problem that we're going to use an entire care team to kind of attack that patient's diagnosis, I guess. So what led me to athletic training was I was a senior in high school. My primary sport was volleyball, even though I was at a tiny school, so I played all the sports. But I had an injury that years later I found out was an avulsion fracture, and I just thought it was absolutely insane that no one was there to help me. I went to an inner city school in Pittsburgh, Pennsylvania, so no surprise, and 2000 that there's not an athletic trainer, but that just shows how far athletic training has come in the nation, that there's been a real push to make sure high schools have athletic trainers. But, I had that injury and it kind of changed a lot of things for me. Thankfully, I had an academic scholarship, so I wasn't relying on athletics to go to school, but a lot of people are, and that could have changed the entire trajectory of my life. So once I went to school, I already knew I wanted to be in athletic training. I just fell in love with the body and the athletic setting. So the body is an amazing, system. So I really loved how your body always finds a way and it adapts. And you're not always going to heal perfectly from injuries, but that doesn't mean you still can't reach your top goals. And then I would say, as I got older in athletic training, I really realized my life philosophy was teaching. And so teaching students, teaching student athletes or patients about their body, how to navigate the healthcare system, how to be an advocate for themselves and what they need. I mean, in 2024, we all know, women's health isn't really the top tier. So really teaching my female athletes how to advocate for their health, how to be heard, and how to speak and use the language that, doctors might appreciate more to get to their needs. My advice to young professionals, especially with the change in education, now only having 2 years of actual didactic work in athletic training, is you have to be a sponge. You have to realize that there's a lot of different ways to get to the same end goal. And the key is not to just kind of stick to one. Your job is to know all of the ways so that you can fit the best care plan approach with your patient. If you only know one way to tape or one way to stretch or one way to rehabilitate a specific injury, that might not align with the preferences of your patient. So be a sponge. Realize you are never going to stop learning. You graduate grad school and you're still a baby. Even 16 years into my career, I'm still learning. Medicine changes constantly. So your work as a lifelong learner is never over. So just be a sponge and accept we're always learning every day. I would say so, especially some of the athletes that end up going into the healthcare profession. Sometimes it's silly. They'll call me and say, oh my God, I just learned about dry needling, or I just learned about this joint mob, or you taught this so much easier than what I'm trying to. Can you refresh me? But my favorite is when my previous patients, they share their life milestones. They send me pictures of their kids. They send me videos when they're like, hey, remember when you taught me how to do my first 3 steps or transition appropriately in a sprint, or, rehabilitate, like I said, a hamstring or something like that, and they can help their kids through that themselves. That's how I really know I did my job, that the things that they learned here, they were able to take and apply in their life to help others. I think the evolution of athletic training, you were steering me towards that a little bit earlier, but no, I had no idea what I was getting into, because in 2002, when I was a freshman in college, athletic training was this, and now athletic training is this huge thing. I don't even think in 2002 we were considered or really accepted as healthcare professionals. So in the last 20 years, that's kind of crazy to think, but in the last 20 years, the evolution of the expectations, the skill set, the opportunity. Athletic trainers aren't just in the high school, collegiate, and professional settings. We're working at Amazon, we're working with LL Bean, we're working with the military and special forces, firemen, and there's just a lot of areas that we can serve. And again, it's just so much about education, and helping someone navigate the healthcare profession, or not profession, sorry, the healthcare field, so that they can get what they need. So I loved Lamar University. I could have stayed there forever, but there just wasn't opportunity. And I always had this question in the back of my mind, like, what makes them so great? And it came down to resources and people. So at all of the institutions I was at previously, there were 3 of us. We covered tons of sports. It might be 3 people to 600 or 700 athletes, or it might be 3 staff members who are trying to bring up grad students who are covering their own sports but still require a lot of education and mentorship. So, I said I fell in love with teaching, but I realized I'm becoming too good of a teacher and not a good enough clinician, and I was just determined to see where I could peak at as a clinician. And I still haven't peaked because I'm still learning. So that's what's exciting about Michigan, the people that take you under their arm and the amount that they're willing to invest into a person. If you want to grow and you make that known, they're going to invest in you. So that's what I would say, that's what kept me at Michigan, the people, and me being hungry to grow, being hungry to take on projects, and how much support that I got to do that. Absolutely, that's actually what I wanted to highlight this month. I started undergrad in 2002, and athletic training was a baby in the healthcare professional industry. I think we were introduced as healthcare practitioners in 1990. So in the early 2000s, I'm going to be honest, as a student, as a young professional, I did not feel like we were part of the community. But over the last 10 years, especially in the post-COVID era, we serve as healthcare practitioners. It's not just taping ankles or covering. We are providing medical care for a wide range of orthopedic injuries, for mental health conditions, for illnesses or general medical conditions. So I think the evolution and the expectation of us to be these general practitioners while also maybe having a specialty like manual therapy or rehabilitative interventions is a big difference from what I went to school for as a young athletic trainer. Sure, so at least in the collegiate athletic training setting, we carry a lot of responsibility with mental health care, mental health awareness, being kind of the boots on the ground to identify anything that might need addressed. Of course, athletic trainers have been mentors and counselors for years, but getting to the higher level care that someone might need if they have an eating disorder or anxiety and depression. I think the post-COVID era with the huge mental health awareness, and that there's a lot of people that are working through things. So on a day-to-day, I might be helping student athletes with coping mechanisms, working through a panic attack, the mental health implications that come with having a concussion or a long-term injury or even a short-term injury. They might be still on the court, but they're not able to do what they're used to being able to do, but it's something they can work through. So all of that kind of comes with a little bit of mental health strain, and us needing the education and the awareness to support those challenges that the student athletes might face. I think also a different component of the job people might not realize is quality assurance and quality improvement, where we have quite a few initiatives to constantly be assessing and reflecting on the care that's provided and making sure that we're utilizing patient-reported outcome measures or utilizing data and statistics from our documentation to improve the care that we give to our student athletes and patients.